welcome to HIMSS 2012. I'm here with MEDSEEK, and in particular I'm here with Grehalva, who is the Senior VP of Consulting and Marketing. Is that right?
That's correct.
Well, welcome.
Thank you. It's good to see you, Cindy.
Yeah, so let's start with the basics, Rich, and tell us a little bit about MEDSEEK.
Well, you know, MEDSEEK's been around for 16 years now, and we've been focused on one thing and one thing only, and that's the digital health transformation for hospitals. So we want to make it easy for them to integrate and interface from an e-health perspective. And now what we've been looking at is a 360-degree experience helping patients, physicians, clinicians, employees, and the community at large. And really, at the end of the day, we're really focused on how it can help them with new sources of revenue and reducing new costs.
Great. So I want to ask you a few questions.
Sure.
And the first one I wanted to ask about was social media. So we use it all the time in our daily lives, when we communicate with our friends, when we IM, when we make travel reservations, music, and any kind of, even viewing movies on tablets and things like that. So how are you guys embracing social media at MEDSEEK?
We know in a very big way, because the internet was not made for marketeers and advertisers. Television was, and they depend on advertisers. The internet's about moving information and content and getting data. And we know that 74% of Americans are already going online. So we've just announced today during a conference that we're working with a company called Bright Whistle. And Bright Whistle, it's a very cool company. And what they do is they have access to the Facebook API. So when people are searching on information about a hospital or a particular service line of excellence like cardiology, they're able to take what's already in there. So once someone likes a hospital, is they can take that API and then they can pass that information, because what it's called is social. So we do a social sponsorship. It's a story. And that story goes to everybody she likes, and anybody else can take a view of that, as well as our predictive modeling. Predictive modeling has been able to figure out where the e-patients are and then bring them up and target them for social sites.
So this is hot off the press, right?
Hot off the press. We're doing the announcement this week.
Bright Whistle, hot off the press. Okay.
Great company.
Great company. I'm glad you guys are associated with them. That's wonderful. I'm glad to hear about it. So the other question I had, the major question I had, was about health exchanges. And we talk about accountable care organizations, health information exchange. In fact, Gartner is saying that within 2014, I think it is, 30% of the private healthcare payers are going to be associated with physicians. And we're actually seeing a lot of that now, because payers buying providers, providers buying payers. How do you guys work in that accountable care space?
Well, no, one of our newest clients, one of our flagship clients, is Banner. And Banner is one of the 43 ACO pioneer hospitals.
Okay.
And what they're doing is using one of our products called a virtual medical office, and kind of view that as an employee portal for physicians.
Okay.
So it allows them to interface with the information that they have available. But more importantly for Banner is they have their own database. So it's much more richer in content.
Right.
And when they hook up with the HIE for Arizona, that's just going to be another node. So what it allows them to do is increase the productivity of the physician. They're also using our patient portal to go out and reach patients to get engaged in their own care.
Okay.
So it's a way of reducing it. And with our new tool coming out of EcoSmart, we can now look at the propensity of people who are going to actually use the internet, so we can help them engage in using the patient portal that way. Okay,
great. So can you just give a little bit of a background on what the Pioneer program is?
The Pioneer program is sponsored by ONC, so they were looking at very few hospitals that actually have to apply to see whether or not they were going to be one of the very first to go into an ACO. Banner's one of those.
Okay.
So Banner is already in the forefront of population health. They're going to look at what they can do to make a difference in healthcare.
Okay, thank you for doing that. So I understand you guys are starting a new program, the Institute for Healthcare Executives. What's that about?
Well, it's the Institute for Digital Health Transformation. And that's one of the overlooked trends, I think, in healthcare right now. If you look at everything that's happening with an EHR and HIEs and personal health records, all those things are trying to figure out how do we get to be electronic. And right now there's no place for a C executive to go and get that information, case studies and the like. So what we're doing is bring people together, take a look at the case studies after 16 years we have that, and provide that as a tool to member hospitals, as well as getting e-patient Dave is going to be working with us. Okay. E-patient Dave from a patient perspective, the physician perspective, and the C's. Okay. So we're really trying to figure out how to get the information out there, make a difference in healthcare.
Great. A lot of decisions are made by our joint mutual customers on an ROI.
Yes.
Can you guys tell me about your ROI for a couple of customers?
Well, you know, two come to mind. One is Allegiant. Allegiant's been using our EcoSmart product, and they've been able to generate almost $27 million of new revenues that they wouldn't have had otherwise.
27 million.
Trinity is actually almost at 32 million.
Wow.
And what they're doing is something a little different along with the tool. They're looking at ways for utilization. So they looked at their frequent ED players,
right,
the people that are coming there, and now they're pointing them to clinics, care clinics, and they're able to save money and time and actually increase their revenues.
Oh, that's great.
Yes.
So as we wrap up, tell our audience a couple things you'd like to leave them about MEDSEEK.
Well, you know, every day we at MEDSEEK wake up with one thing and one thing in mind only, and that's helping our hospitals to engage patients and physicians in a better way of serving their communities.
Great. So I want you guys to go to medseek.com and look up more information about Bright Whistle.
Yes.
The Institute for Healthcare Executives, right?
The Institute of Digital Health Transformation.
Great. And thank you, Rich. We appreciate you coming.
Welcome.